because it's such a rare disease, the last cluster of cases in Nigeria was actually in the 70s. In those days, we had a case fatality ratio, i.e. about 5% of all cases would have died from it. But it doesn't have to be. If the cases are well managed, detected early, as has been in the case in this particular cluster, the chances are that they will survive. It's a self-limiting illness, which means that there's no specific treatment for the virus. But if we manage the symptoms well enough, most cases will survive. The virus actually circulates in a few more animals apart from monkeys. So rats, squirrels, and what is generally called bushmeat in our context. Now, the period of increased risk is actually at the point of either killing, so those that either kill to eat, but it's not the eating that is the problem. So once you eat well-cooked or well-fried meat, you're perfectly fine. But it's the people that actually touch these animals, prepare them, kill them, and are in contact with them, and then don't use personal protective equipment and don't wash their hands afterwards. And now, once that virus then gets into a human population, then there's a risk of human-to-human transmission, which is what has happened in Bayelsa. In Bayelsa, we have about 3 clusters. 2 big clusters, about 6, 7 patients are all linked to the same patient, and then the other one is another cluster of 4 or 5 to come, plus 1 healthcare worker who was managing one of them. So the 2 sources of infection, firstly from animals to humans, and secondly from humans to humans. So we've done some preliminary testing here in Nigeria, and then we're sending the samples to Senegal, to Dakar. It's not a lab that belongs to the Senegalese government. It's a WHO regional reference lab in Senegal, that is hosted in Senegal, that supports the West African region. Because it's such a rare virus, it's not something we test for every day, so you need to send a sample there for confirmation. But you see, the clinical features of monkeypox are so unique that very few other diseases that would present like that. The other disease that is similar, because the much more severe disease was smallpox, but we know that that has been more or less, it has been eradicated for many years. So that's kind of why we're fairly sure that we're dealing with monkeypox in this case. One characteristic it has in common with Ebola, in terms of there is probably circulation in the animal populations for long periods of time, and then from time to time it will jump into a human population. So that's exactly what has happened in this case. We think it's been circulating in the animal population. Somehow a sick animal has come in contact with a human. So someone must have touched a monkey, which is most likely the case in this scenario actually from the history that we got. And that virus then got into a human population and circulated a little bit. There's a history with a contact with a monkey in the index case, so it's most likely that's how transmission happened. But for us to confirm that, you need to get a sample from both the monkey and the humans and to see that it's the same virus. And the monkey in question is no longer alive to give us a sample. So we will most likely remain, it's the most likely scenario, but it's unlikely that we can confirm that because the monkey is no longer alive. So we've had a team in Bayelsa for more than, since the 20th, basically, supporting the state government in the response. When you start an investigation like this, you have to do the work required. Once you create panic without having done the work, it can lead to all sorts of circumstances. So we took some time to confirm what we're dealing with, talk to healthcare workers, make sure the doctors are confident to deal with the patients, go to the homes of the patients, inform them of what is happening, and manage their anxieties. And then 2 days ago, we decided it was now time for the Honorable Commissioner for Health in Bayelsa to go public with this. And that's when the press became informed. So really, that's the nature of our work. It's a little bit like the work law enforcement does. If you say you're looking for a criminal before you have your act together, the likelihood is that he will disappear. So in the same case here, we had to do some background work first, have a team on site, support the state, and at the appropriate time go public with this. Yeah, both the name and the appearance of cases with this rash all over the face leads to a lot of anxiety, which is why we have taken a fairly aggressive response in terms of aggressively communicating with Nigerians. We put out a press release yesterday. Today we'll put out an advisory. So we're really trying to communicate with people. We don't want to hide the fact that there's an outbreak of monkeypox, but at the same time we're trying to explain that yes, it has a name that sounds fairly worrying. The images are fairly worrying, but in reality this is not a disease that kills under normal circumstances, and it's something that we're handling. There's no serious aftermath apart from one. It's an aesthetic one. So you stay with the scars of the rash for quite a while. If you're a child, it's most likely that they'll disappear with time. As an adult, it's a little bit more tricky. So really, the biggest challenge is the appearance problem. So it's something we have to take very seriously because it leads to a little bit of stigma and all of that. So we have to support patients, assure them that even if there's some scarring on their faces, there's no long-standing physical outcome to worry about.